Cancer is a very scary and unnerving time when you're first diagnosed, and not knowing what to expect can often make it worse. So here at the Lax Cancer Center, we want to make sure that we've answered your questions about your diagnosis, your treatment options, and help you make that treatment decision. When you're first diagnosed, you're going to meet with a medical oncologist who is going to develop a specific chemotherapy plan based on your diagnosis, your stage, and your other health factors. That plan is determined based on national guidelines. Once your physician has developed a treatment plan for you, we will do a lot of work behind the scenes before you come in for that first chemotherapy. A financial coordinator will look through your specific insurance plan, your specific co-pays, deductibles, etc., and evaluate your coverage. If there are any issues at all with coverage, they will talk to you about what those co-pays might be, and if there are co-pay assistance programs. We want to make sure that you're starting this with everything being covered and no other questions being unanswered.
A patient will meet with myself or one of the nurses that educate after their initial visit with their oncologist. During that appointment, information is gone over how the chemotherapy is given. We also go over how long they'll be here and what to expect during that time. Patients are encouraged to just wear whatever they're comfortable in. They don't need to bring really anything specific for chemotherapy. We usually encourage patients to have a driver, someone to be with them during chemotherapy. We also help with assistance with transportation. If someone needs that assistance, we can help get rides set up for them to come to their chemotherapy appointments.
When a patient first walks through our door, they're going to be greeted by our receptionist, who is going to get their photo ID, their insurance card from them, any paperwork that's been mailed to them ahead of time.
You will receive lab work at most of your visits, not all of them. We have a lab facility right here in our first floor suite where the chemotherapy is given.
A medical assistant will come and get you from the waiting room and take you back to get your weight and sometimes your blood pressure, depending on the treatment that you're receiving, and she will get you seated either in a recliner in our open infusion area where you'll be with other patients, or you could be in a private room.
Chemotherapy is given by the oncology certified nurses here at the Lax Cancer Center in the outpatient infusion center on the first floor. Chemotherapy does not hurt when it's given. They shouldn't feel any pain. Generally, side effects start 2 to 3 days after chemo, and for most patients don't last more than 3 to 4 days. Nausea is one we talk about a lot. Patients get very concerned about that, whether they're going to be nauseated. So we talk about medications to treat that, medications given with chemotherapy, and things they can take at home to treat nausea. As far as patients that may lose their hair with chemotherapy, one of the great resources here is the personal care shop.
The personal care area here at the Lax Cancer Center has multiple services. They will work with patients to find a wig that works for them. Some patients prefer different scarves or try on different hats. Also in the personal care area, if a patient has been recently diagnosed and is going to be starting chemo, they can get their hair cut there for free.
Our goal here is to provide exceptional care to each and every one of our patients. We have a whole team that help provide this care, so it's not just one person saying this is what you need, go ahead and get your chemotherapy and we'll see you in a couple weeks. We are here to walk along the journey with you. We provide not only the medical needs that you may have, but we provide people to help you with that emotional side.
We're able to establish relationships with our patients, cry with our patients, laugh with our patients.
You'll often see our nurses in the infusion area taking the time to just hold someone's hand and listen to them. And not only just listen, but do whatever it takes to help you through this process.